Standard veterinary medicine is built on identifying a specific pathogen and neutralizing it with a targeted chemical agent. This model operates on direct intervention. Dr. Surjit Singh Makkar's Veterinary Homeopathic Clinical Materia Medica offers a different architectural approach to animal health. The foundational text replaces pathogen targeting with a rigorous, systematic methodology focused on the patient's reaction to illness. Practitioners utilize a granular matrix to record data points, ranging from basic species information to behavioral shifts and environmental triggers. This data is synthesized to find a precise resonance between the patient's current state and a remedy's pharmacological profile. This point of resonance is known as the Simillimum, a catalyst intended to engage the animal's vital force, or its internal regulatory system for self-repair. Locating the Simillimum requires a deconstruction of the three analytical pillars supporting this methodology. These pillars consist of the symptom matrix, the logic of modalities, and potency scaling. Effective diagnosis begins at the most granular level of the patient's presentation. In this framework, the practitioner functions as a precise analytical filter, processing multi-system variables to determine the correct biological match. Broad diagnostic labels provide insufficient data for this model. Knowing an animal has arthritis doesn't narrow the field enough to select a specific remedy. The symptom matrix constructs a three-dimensional clinical picture, evaluating the nervous system, digestive health, and musculoskeletal integrity as an interconnected whole. Consider the case of a Labrador with tick fever. The matrix identifies a specific fever cycle, a bloated abdomen, and hypersensitivity to touch. These combined indicators point directly to caninum sulfuricum. A standard treatment might ignore the digestive or tactile symptoms, but this framework requires addressing all three. The matrix also prioritizes neurological and behavioral shifts as primary clinical data. In a horse presenting with lameness after training, the Materia Medica notes specific head-flicking behaviors and a refusal to turn right. The physical lameness is linked to a neurological shutdown triggered by the intensity of the exertion. Because behavioral avoidance is the primary indicator, the framework leads the practitioner to select Epiphagus virginiana. Addressing only the physical limb while ignoring the emotional trigger would leave the case unresolved. The symptom matrix treats behavior as a physiological metric, ensuring the chosen remedy corresponds to the entire biological state of the patient. This raises an analytical challenge: how to distinguish between two patients with the same physical symptoms, such as joint stiffness. The solution lies in the second pillar, the logic of modalities. Modalities are the environmental, physical, or emotional factors that either improve or worsen the animal's condition. Tracking modalities acts as the ultimate filter, revealing how patients interact with their surroundings. The text specifies Formica rufa for joint stiffness aggravated by cold and damp, but improved by gentle, continuous movement. We see this logic in reverse with Bryonia alba. For a Bryonia patient, any movement at all causes intense pain. This requires a completely different remedy, even if the primary symptom is still joint stiffness. A third layer of contrast appears with Belladonna. Belladonna is disqualified if cold air provides relief, as its modality is defined by aggravation from heat and touch. Selecting a remedy based on physical symptoms alone, while ignoring the modality, usually leads to a failure in treatment. Modalities demonstrate that the framework views the animal as a reactive biological system in constant dialogue with its environment. Once the remedy is identified, the practitioner must determine the correct potency. Homeopathic scaling follows a specific paradox. Potency scales inversely to the physical concentration of the dose, but it scales directly to the depth of the pathology. The lower tier, 6C or 30C, is utilized for acute physical trauma or surface-level metabolic issues. In clinical practice, Bellis perennis is applied at low potency to clear muscle bruising after surgery. When the pathology is long-standing or involves the nervous system, the framework mandates moving to the upper end of the scale. High potencies, like 200C or 1M, are reserved for chronic degeneration or deep neurological disorders. The text cites the use of high-potency Hecla lava to treat chronic calcified bone growths in horses. Similarly, high-potency curare is required for severe neurological failures, like Downer-Cow syndrome. Lower potencies resolve immediate tissue damage, while higher potencies are calibrated to address the patient's systemic vitality. Potency scaling matches the analytical weight of the medicine to the chronicity and depth of the disease. The diagnostic life cycle described in the Materia Medica requires a complete synthesis of these elements. The practitioner combines the symptom matrix with environmental modalities and species-specific data to reach the Simillimum. This methodology relies on clinical precision, using specific patient data to trigger a targeted physiological response. Success depends on correctly linking physical pathology to behavioral shifts and environmental reactions. Omitting any one of these three pillars collapses the analytical integrity of the entire framework. Mastery of this system requires identifying advanced rubrics, such as using floricum acidum specifically for non-healing ulcers and deep tissue necrosis. Within this system, the practitioner assumes the role of a biological data analyst. They process complex, multi-system variables to find a mathematically precise resonance for the patient. By navigating this systematic matrix, the practitioner selects a potency-calibrated remedy designed to stimulate the vital force, the animal's own internal mechanism for systemic recovery.